Dr. Pollan up at Harvard has cured schizophrenia using keto diets.
So can a ketogenic diet cure schizophrenia? For starters, I think Secretary Kennedy meant to refer to Dr. Christopher Palmer, who's a Harvard psychiatrist involved with research on the question. For context, a ketogenic diet is essentially a low-carb, moderate-protein, high-fat diet developed over a century ago, initially for people with epilepsy. This was prior to the advent of medications. Today, a ketogenic diet can be used as an adjuvant therapy in epilepsy, meaning in addition to the standard of care or for those for whom medications have been ineffective. The same question is being asked in the case of schizophrenia. Is there a role for a ketogenic diet as an adjuvant therapy, meaning in addition to the standard of care, which is things like medication therapy? To date, most of the studies are fairly low on our hierarchy of evidence. There are things like case reports and case series. There was a clinical trial in 2024 that was a pilot trial. It had 23 patients, some of whom had schizophrenia. Among those with schizophrenia, about a third reported reduction in their symptoms, according to the subjective rating scale. They also reported some weight loss. There was a reduction in insulin resistance, so some other metabolic health benefits. There are some interesting mechanisms proposed for how a ketogenic diet might be helpful in the case of schizophrenia. Many of the medications involve the dopamine pathway. There's speculation that maybe ketogenic diet through the ketones modulates things like other neurotransmitters, modulates the inflammation or oxidative stress on the body. All these things are interesting. All these things are good and worth pursuing further. Do these constitute a cure for schizophrenia? I think to say that, you would need large randomized clinical control trials, double-blind, meta-analyses. You need hundreds, if not thousands of patients. You need to show that the diet resulted in a remission of symptoms, not simply a reduction that was sustained over years without any medications, without the standard of care. And none of those things are there yet. So does it cure schizophrenia? No.